So what prompted you to undertake this study?
Well, this has been a passion of mine. In 2018, Dr. Jeff Peterson and I presented some data on some patients that we had that had gout that were being treated with pegloticase. And we came up with an idea that, if we could use another medication or something to help make the pegloticase work better, that this would be good for our patients. And ultimately, that's it. We're doctors on the ground, and we see patients every day, and this is just one way that we can hopefully help to treat our patients better. So that's kind of where the idea sort of came from.
And what are the key takeaways from the study?
Well, so there's kind of two parts of the study that we've brought out this year. The first one was the basically the information regarding the mirror open label. So this is an ongoing study that basically mirrored what we did as individual physicians. So essentially trying to create a way to make the pegloticase better. And so essentially in this study, this is called the mirror open label, which the initial results for the first 6 months were actually previously presented, where basically we enrolled patients that had gout, uncontrolled gout. We said serum uric acids greater than 6 that previously failed other treatments, so oral agents, etc. And these patients would get enrolled and receive methotrexate as a medication for a month before they received their first infusion of pegloticase. And basically, like we saw when we did our initial case series, where patients responded much better to the pegloticase versus the randomized controlled trials. So maybe a little background on that part. The randomized controlled trials that got pegloticase approved was about a 42% response rate. So less than half of the patients actually responded to the medication or were able to complete a full treatment. And so by adding the methotrexate, what we saw with our 10 patient case series was that we had 10 out of 10 patients be able to complete the treatment. So this is pretty exciting news, obviously, for us. And the mirror open label was a way to sort of reproduce that. So in a more controlled fashion, the patients were seen that way. So basically, there was 14 patients that were in the mirror open label. They received the methotrexate first for 4 weeks, then received the pegloticase. And at the primary endpoint, which was at 6 months, whether they had a serum uric acid less than 6, 11 out of 14, so 79% of those patients were able to make it to have a complete treatment or to be a responder at that point. So nearly doubling the baseline rate, if you will, the rate from the randomized controlled trial. So that was kind of the background on it. This particular poster here presented the data basically for the next for the 12 months. So the next 6 months primarily was being focused on. So what happened to these patients that were able to respond at the primary endpoint at 6 months and go out to 12. And this is where this kind of poster fell in. And the key takeaways for this is that of these patients that were considered responders, well, there was one patient that couldn't go on further because the trial actually changed. There was originally only a 6-month trial. So one patient dropped out because of that. And then 2 patients actually met their treatment goals at 6 months. So they did not continue to receive pegloticase, but they also actually did get monitored. And of those 2, one of them was still a responder. Both were a responder at 9 months, and one was a responder at 12 still. But then of the 8 patients that were left in that cohort, all of those patients remained responders at 12 months. And I think that's the biggest takeaway from this is that these patients now are more likely to respond, and they will remain responders throughout their treatment. The other sort of secondary takeaway maybe was the gout flares. So obviously gout flares are our biggest issue when we're treating these patients. It's the number one sort of side effect, if you will, or adverse reaction, if you will. And those all reduced. So in the first 12 weeks, we saw about 92.9% of patients have a gout flare. By weeks 37 to 52, sort of the end quartile of the treatment, that dropped to 25%. So now we've got patients that are maintaining a serum uric acid that's low, their gout and tophi and outward clinical symptoms are improving, and their gout flares are improving. So sort of the best of all worlds there. And so that, I think, was the biggest takeaway. The second poster that was presented was also from the same cohort, so from the same mirror open label. And this was maybe a little more basic sciencey, a little less clinical, but in this case, we also looked at, well, why is this happening? So we've always had this suspicion that the reason that the medication methotrexate works so well with pegloticase is it prevented these anti-drug antibodies. So these antibodies that were attacking the medication, sort of neutralizing its effect, eliminating it quicker. And we've always had this kind of thought that, well, this is probably what's going on, because we see this in other diseases and other rheumatologic processes. Actually, part of the reason we got to methotrexate, because we use methotrexate with some of our other diseases. And so the theory is that, in fact, we're probably trying to, helping to prevent these anti-drug antibodies from developing. And the bottom line of the second poster, was that, we did see that. We did see the anti-drug antibody levels less. And for comparison purposes, in the randomized controlled trials, about 89% of patients developed anti-drug antibodies. Now, some of those patients still responded, even though they had anti-drug antibodies, but 89% had these anti-drug antibodies. In the mirror open label study, the number was 2 patients out of 14 that had detectable antibodies. So percentage-wise, you're looking at about 14 or so percent that developed these antibodies. So that data really helped to sort of support what we saw clinically. It also supported that, using methotrexate with pegloticase doesn't cause a drug interaction. It doesn't affect the mechanism otherwise of the pegloticase, except potentially through that anti-drug antibody mechanism. So that's kind of the biggest take-home points clinically, of what we're seeing, an opportunity to treat these patients better, and some insight into why it's happening, sort of verification of what our clinical theories were in the beginning, which is always nice in medicine. It's always nice to have those things match. And then we have a little data for that now.
Did any of the study's findings surprise you?
Not really. I think it was encouraging because this was kind of what we were seeing clinically. This was a reproduction, if you will, of our original case series. And there's been multiple other case series presented too that really had similar findings. So, this was the most cohesive, sort of systematic way of looking at this versus these case series that were presented. But it didn't really surprise me, because this is kind of what we expected to see. It was good to have the verification, though.
What limitations did the study have?
I think the biggest limitation to the study, like any open label, is just not having a comparator group. It was also a small number of patients. 14 patients is a fairly small number to have in just a study. But I think the nice thing about this is it sort of did prove and support further that idea that this is the way to treat patients, and actually leads to hopefully a more robust bit of data with a randomized controlled trial that's actually enrolling right now, and it's under the same name, mirror open label or mirror randomized controlled trial. So I think we'll see more data with that, but that's always a limitation in these. It's just a small sample size, and how much of it you can actually, how much of the data and the results you can actually bring out to your full patient population, if you will. So.
My next question was if you have any future research plans for this area, and it sounds like you do. So do you want to maybe touch on that a little bit?
Yeah. So the one that's exciting, obviously, is the mirror randomized controlled trial. So essentially, did the same study as the mirror open label, but with a comparator group with a placebo. So essentially, a group that received pegloticase monotherapy. So that's enrolled fully now, and should see results early next year. So that's pretty exciting. And maybe the one other study to maybe touch on is one that just was recently announced, and that was the Agile Study, which is basically a similar study, but trying to make the infusions experience a little better for patients, having a shorter duration of the infusion. So that one will be enrolling its first patient really soon. So that's also pretty exciting.
Is there anything else that you wanted to add that we didn't cover in the questions so far?
I don't really think so. I mean, I'm always really excited to talk about this. It's kind of near and dear to my heart. I think, maybe the only thing I would add is just, we're trying to do things that make the experience better for patients, that make their clinical response better. This is a really tough population of patients that really has no other options. By the time they get to pegloticase, this is it. This is their last line of treatment. And so the better we can do to make these medications work, the better it's going to be for our patients. And I think, every day when we're all seeing patients, I think that's what motivates us to do this, and what motivates us to come to work every day to see these good responses. So I think that's probably the takeaway I would leave at that is just, let's keep our eyes open, keep our heads open, and try to get better results for these patients.